Welcome to the Maternity Mentor. Today we will be talking about birth control options after having a baby. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Birth control options are one of the first things you think about after having a baby. Let's explore what types of birth control you should consider after giving birth to your baby. The first question you may have is, when can I start using birth control? The answer is, it depends on the method you decide to use. IUDs can be inserted the same day you deliver, and you can request this from your healthcare provider if you desire this. Hormonal methods will usually need to be delayed 4 to 6 weeks after delivery. This is because after delivering a baby, you are at higher risk of developing blood clots. Hormonal birth control methods also increase this risk, so it's safest to wait. Additionally, hormonal birth control methods may adversely affect your breast milk supply. In general, birth control options must wait at least 3 to 4 weeks after the birth of your baby. The most popular and well-known form of birth control is the birth control pill. There are two types: a combination pill that contains estrogen and progestin, as well as the mini pill, which is progestin only. The combination pill is safe for most women, but should be delayed for 6 weeks due to the increased blood clotting risks. The downside is that it cannot be taken while breastfeeding because it can decrease milk supply. You will also get a period once per month because of the 7 days of inactive pills contained in the pack. If the birth control pill is not taken correctly, you can get pregnant again. So it's extremely important that you take the pill every day, preferably at the same time every day. Also, many medications, including antibiotics, can interfere with the effectiveness of the birth control pill, so you will need to use barrier methods when taking a new medication. If you're on a long-term medication or get prescribed a new short or long-term medication, you should check with your healthcare provider and your pharmacist to see if the medication will interfere with the effectiveness of the birth control pill. For women who choose the birth control pill but desire to breastfeed, the healthcare provider should prescribe the mini pill. The mini pill contains progestin only, which shouldn't affect your milk supply. It also doesn't come with inactive pills, so you shouldn't get your period. However, you should not start the mini pill until breastfeeding is well established and your baby is growing well. If you're returning to work soon, you may want to delay starting the mini pill because some women will see a decrease in their milk supply at that time. There are many other hormonal options, including the patch, the ring, the implant, and the shot. The patch is applied once a week for 3 weeks and then removed for 1 week, which is the time you will get your period. This is a great method for women who may not remember to take a pill every day. However, if it is not applied on the same day every week, it reduces its effectiveness, and a backup method will be needed. The ring provides hormones, which causes your cervical mucus to thicken. This makes it harder for sperm to pass through and travel to the egg for fertilization. You place the ring inside for 3 weeks and remove it for 1 week, making it easier to remember. However, you must be comfortable inserting your fingers into your vagina to place the ring. The implant is a newer option available to women. It is progestin only, which means breastfeeding women may also consider this option. The implant is a small rod that is inserted into your arm using local anesthetic. Once in place, it lasts for 3 years. However, once it's in place, if you're having side effects from the medication, the implant cannot be removed without having a minor procedure. It must be removed in the office, again using local anesthetic, and a small incision will be made, which may cause scarring. The final option is the shot. This is a very effective form of birth control, and it lasts for 3 months. It is also an option that can be administered right after birth. The shot requires a commitment to go to your healthcare provider 4 times per year to receive it. Also, once injected, the medication is in your system. It cannot be removed. So if you have adverse effects, which can include heavy breakthrough bleeding, you simply must wait it out. It can also take up to a year to get out of your system, which may cause some issues getting pregnant again. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about IUDs. IUD stands for intrauterine device. It's a small device inserted into the uterus to prevent pregnancy. There are 2 types, hormonal and non-hormonal. The hormonal IUDs deliver progestin into the uterus to thicken your cervical mucus. Again, this makes it difficult for sperm to get to an egg for fertilization. A hormonal IUD can be left in place for anywhere from 3 to 7 years. Non-hormonal IUDs are made of copper. This form of birth control triggers inflammation in the uterus, which makes it an unfavorable environment for sperm. Non-hormonal IUDs can be effective for up to 10 years. Women need to be careful when using a non-hormonal IUD because the inflammation may affect more than the uterus. These IUDs can also cause heavier, longer periods as well as breakthrough spotting. The advantage of both IUDs is that once it's in place, you do not have to do anything else to achieve effective birth control. You will require a mild procedure to have it removed and replaced at your healthcare provider's office. There are several barrier methods that can be used to prevent pregnancy. First up are condoms. You can purchase both male and female condoms easily. They're relatively inexpensive, and in many areas, male condoms can be obtained for free from the health department. They are non-hormonal and will not be affected by medications. They must be used prior to the insertion of the penis into the vagina. Another option is the diaphragm. The diaphragm is a soft, fitted cup placed over your cervix to prevent sperm from entering the uterus. You will need to use this with spermicide, which is a medication that kills sperm. To use diaphragms, you need to be comfortable inserting your fingers into your vagina. Diaphragms also need to be refitted after you've had a baby. A cervical cap is similar to a diaphragm, but is smaller and fits over the end of the cervix. It is also available in many sizes and will need to be refitted after having a baby. Like the diaphragm, you will need to use spermicide and insert it using your fingers. Finally, you can use the sponge, which is made of foam. It contains spermicide and works by blocking entry to the uterus as well as killing the sperm. However, the sponge is only 76% effective for women who have had a baby, making it not a popular option for birth control. Tubal ligation is also known as getting your tubes tied. This is a procedure where your OBGYN will tie or cut your fallopian tubes. This removes the connection between the ovary and the uterus, preventing sperm and egg from connecting for fertilization. Tubal ligation requires serious consideration because it is a permanent form of birth control. It can rarely be successfully reversed despite what you may have heard. If delivering in a hospital, you may be able to schedule having your tubal ligation after birth and in the case of cesarean sections, during your birth. Tubal ligation also does not interfere with breastfeeding or milk supply. 2 other options commonly discussed are lactational amenorrhea method and the rhythm method. These methods have varied effectiveness, and effectiveness is based on following the methods exactly. In lactational amenorrhea method, a woman relies on breastfeeding to prevent ovulation or the release of an egg for fertilization. For this method to work, a woman must be exclusively breastfeeding with a minimum frequency of every 4 hours during the day and every 6 hours at night. This method is only effective for the first 6 months of your baby's life if no other food or milk is introduced, or until you get your first period if prior to your baby's 6-month birthday. For some women, this method is effective for a lot longer, even when they are offering foods. For other women, they can be breastfeeding even more frequently and still get pregnant, making this an unreliable method. The rhythm method involves tracking when a woman ovulates and then avoiding sex or unprotected sex during this time. For postpartum moms, this is not a viable option because you're unable to tell when you ovulate until you get your first period, which can take 6 months or longer. However, you may ovulate without having a period. Also, some women's cycles are not regular after giving birth, making it difficult to track ovulation. Discussing birth control after having a baby is very important for your physical health and well-being. I hope this has explained the different types of birth control options available after having a baby so you can discuss the right option for you with your healthcare provider. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.